Hello and welcome to the Montefiore Center for Joint Replacement Surgery. You and your surgeon have concluded that joint replacement surgery is the right decision for you. We are going to discuss what you need to know before your surgery, on the day of your surgery, what to expect during your stay with us at the Joint Replacement Center, and we will even make plans for your discharge home from our center. You will also be meeting other members of the joint replacement team, including a physical therapist who will give you a mini physical therapy session, an anesthesiologist who will be discussing the different types of anesthesia used at the Joint Replacement Center, a social worker who will speak with you about your discharge plans, and a team member from Montefiore Home Care will discuss your rehabilitation and recovery at home. Along with these professionals, other clinical and administrative members of the joint replacement team will be meeting with you. Our goal is to provide you with excellent medical and surgical care in a caring and family-friendly atmosphere. Please let us know if there is anything we can do to improve your stay while you join us at the Montefiore Center for Joint Replacement Surgery. Let us begin by discussing what you need to do before your surgery. Your pre-op lab work will be done at the education session or at the Joint Replacement Center several weeks before your surgery. You should have an appointment to see your medical doctor within the next few weeks. Your medical doctor will provide your surgeon with a medical clearance, so we know that you are in good shape to undergo joint replacement surgery. If your medical doctor thinks that you may need to see another specialist, such as a cardiologist or a pulmonary physician, they will refer you. Remember, joint replacement surgery is an elective procedure, and we need you to be in good shape, both physically and emotionally, so that you can participate fully in the exercise program after your surgery. Please bring an updated medication list to your medical doctor, as well as to any other doctor appointments you might have. And be sure to bring that list with you on the day of surgery. Your medical doctor will go over the medication list with you. There might be some medications that need to be stopped prior to surgery. Some medications can cause thinning of the blood. That applies to some common over-the-counter and prescription pain medication, as well as some vitamins and supplements. Medications used to prevent stroke and some cardiac conditions may also thin the blood. Please do not stop any medications without the advice of your physicians. You will also have an appointment at your surgeon's office before surgery. At this appointment, we will go over the surgical procedure in more detail, and you will have a chance to ask questions or discuss concerns that you may have. At this appointment, we will discuss the risks of surgery. You will go over the consent for surgery. Your surgeon will make sure that your lab work and your medical clearances are complete. You should not eat or drink past midnight before your surgery, unless you are taking certain medications in the mornings which cannot be stopped. For example, if you take medications for your heart, blood pressure, steroids, or other medications, you may need to take these medications with a sip of water before coming into the hospital. Discuss this with your doctors. Please do not stop any medications without your doctor's advice. At this pre-surgical visit, you will receive the time to come into the hospital. You will also receive a call from your surgeon's office 24 hours before your procedure to remind you of the time to come in on the day of your surgery. Again, remember not to eat or drink after midnight before your surgery. On the morning of surgery, when you come into the Center for Joint Replacement Surgery, you may have a valet park your car at the front entrance. You will be directed to the pre-operative area. We welcome family members to accompany you. You will receive a gown to wear, and the hospital staff will secure your belongings. You will see your surgeon and your anesthesiologist and several other members of the joint replacement team. Your surgeon will mark the leg being operated on. The anesthesiologist will discuss the different types of anesthesia that may be used, including nerve blocks. Please watch while one of our anesthesiologists presents this to you.
Hello and welcome to the Joint Replacement Center at Montefiore. My name is Dr. Kisharsky, and I'm a Director of Anesthesia for Joint Replacement Center. We are a part of a team taking care of you along with your surgeons and anesthesiologists. We're here to talk to you about the pain control options to make your recovery as comfortable as possible.
On the day of surgery, you will be greeted by a member of the Regional Anesthesia and Acute Pain Service team who will improve your pain control with regional anesthesia. There are typically 2 injections, one in front of the leg and one behind the leg. You may feel your muscles contract slightly. This is normal. Standard monitors will be placed along with a small IV. You will be given medication through the IV catheter to help you feel relaxed and comfortable during the procedure. We will monitor blood pressure, pulse, heart function, and oxygen saturation in the blood. We will place a peripheral nerve catheter for post-operative pain control after total knee replacement. The placement of the peripheral nerve catheter occurs under sterile conditions. On the day of surgery, you will have 2 options for anesthesia. The 2 options are general anesthesia and regional anesthesia. Some patients may even receive a combination of the 2. General anesthesia is a deep anesthesia resulting in the loss of consciousness and pain sensation. Regional anesthesia may also include a specific injection into your lower back to temporarily block sensation to your legs. An ultrasound machine will be used so that we can deliver anesthetics to the correct location. Once the catheter is placed, it is secured at the skin level and attached to the pump, delivering pain medication during the post-operative period. After the procedure, you will be taken to the operating room, where the anesthesia team will continue your care during your surgery.
We recommend that you bring a small bag with clothing that you would wear to the gym, as well as personal toiletry articles. Please do not bring any valuables with you other than a small amount of money for incidentals if you wish. Cell phones and computers should be given to a family member to hold for you until after your surgery. When you are ready to go to the operating room, your family members can wait for you in the family waiting area. The surgery itself takes anywhere between 1 and 3 hours. When your surgery is over, you will be escorted into the recovery room, also known as the PACU, or Post-Anesthesia Care Unit. Your surgeon or his team member will notify whoever you have designated that your surgery is over and you are now in the recovery room. Once you are in the recovery room, specially trained teams will take care of you. They will monitor your vital signs, manage your pain, and start you moving. We use a variety of techniques to manage pain, including intravenous medications, nerve blocks, injections, as well as oral medications and ice applied to the surgical site. On average, patients stay about 1 to 2 hours in the recovery room, and then you will be escorted to the joint replacement unit. Once you are on the joint replacement unit, rehabilitation begins. We strive to have everyone up and out of bed on the day of surgery. You will spend most of your time walking the hallways, stair climbing, and in the gym. During your stay with us, you will be involved in vigorous physical therapy. Your new joint needs a lot of exercise for a good outcome. The average length of stay in the hospital is less than 2 days, and then you will go home. At the Montefiore Center for Joint Replacement Surgery, we encourage family members to support you. Visiting hours are flexible, but we ask that you respect the privacy and rest that other patients may need. Some of the pieces of equipment that you will see on the unit include an overhead trapeze that will help you get in and out of bed and assist you from a lying down to a seated position. If you had a knee replacement, you may come up from the operating room with a knee immobilizer on your leg and a bulky bandage underneath. If you had a hip replacement, you may come out of the operating room with a hip abduction pillow in place. Foot pumps will be placed on your feet. They are soft booties that attach with a Velcro strap and are attached to a machine that sends air to your feet, which helps increase circulation to your legs and prevent blood clots while you are in bed. You may also have a drain attached to your surgical incision, which will collect any fluid or blood that may accumulate. This will be removed the morning after surgery. You will have an incentive spirometer at your bedside. Using this will help prevent mucus from forming in your lungs, which can lead to bronchitis and pneumonia. If you have had a knee replacement, you may use a CPM machine for 1 to 2 hours a day when you are not active. This machine will passively move your leg to help improve your circulation. It does not take the place of exercising. Don't worry if you forget any of this information. You will have a daily schedule available at your bedside to remind you of everything you need to do. Your stay with us will be 2 days or less. The discharge time is 10 a.m. Make sure to have a family member or friend available to take you home. We cannot let you leave on your own. Most patients go home with home care services. Your social worker will finalize your discharge plans with you. We begin those arrangements several weeks before surgery and confirm those arrangements right after surgery. Patients who have specific needs will have help planning for their needs. The earlier we understand these needs, the better we can accommodate for them. All necessary equipment and medications will be arranged for you prior to discharge. It is a good idea to prepare your home so that it is safe and comfortable for your return. We recommend that you remove any loose cords and area rugs that may be in the way and cause you to trip. Set up a place for yourself that will be comfortable for you after surgery. You should prepare meals and freeze them so they are available for you when you return home. You may need to count on family members or friends for support. While you are with us at the center, we will prepare you to navigate stairs. So if your home has stairs, you will be able to use them safely and confidently. You can safely begin showering prior to discharge. Remove the bandage and allow soap and water to run over your surgical incision area. Pat dry the area and put on clean clothing. Until you follow up with your surgeon, do not rub any creams, ointments, or any products on the surgical site. Soap and water are the only materials that we want your skin to come in contact with. Do not take a bath or go into a pool. There are always risks associated with surgery. We do all we can to decrease the incidence of complications. In fact, the incidence of surgical complications is very low. The risks do include the following, but are not limited to: infection, blood clots, knee stiffness, dislocation of the hip. Let's look at each of these in more detail. Your labs are checked to make sure you have no signs of infection. Also, make sure you see your dentist before the surgery if you think that you might have an infection in your mouth. To help decrease the incidence of infection, we will give you antibiotics before, during, and after surgery. You will receive a package of antiseptic chlorhexidine skin wipes. Please use all of these wipes the night before surgery after you shower. All 6 wipes should be used as directed. Directions for using these wipes are located in the education book on the page that states, "Preparing your skin for surgery." After using the wipes, discard the wipes and air dry yourself for a few minutes and put on clean clothing. On the morning of surgery in the hospital, you will receive another package of wipes. Your skin is also thoroughly cleansed in the operating room prior to surgery. The risk of blood clots is reduced by providing you with medication to help prevent blood clots from forming after the surgery. Many of the devices we use help prevent blood clots. A very active physical therapy program is provided for you to reduce the risk of stiffness to the knee after total knee replacement surgery. A thorough education session as well as physical therapy is provided so that you understand how to decrease chances of hip dislocation after total hip replacement surgery. We encourage you to speak with your surgeon about any concerns that you may have regarding the risks of surgery. We have prepared educational materials for you to look through. They are in hard copy format as well as on our website. Now remember, joint replacement surgery is a team effort, and you are the most important member of that team. Your effort, as well as ours, will determine your outcome. Once again, thank you for choosing the Montefiore Center for Joint Replacement Surgery.